I'm here with Dr. Shah, the director of our Harris County Public Health Department, and with Representative Wally, our COVID czar, who has done incredible work to help us throughout this process. Today we are announcing 558 new cases in Harris County outside the city of Houston, 14 fatalities. In total, we have crossed over 87,000 cases throughout Harris County and the city of Houston, more than 900 deaths. Over the past several weeks, we've heard from school officials, from parents, superintendents, about their concerns with reopening too soon, reopening schools and what they're supposed to do. They tell me they're not physicians, they're educators, they need guidance. At the same time, the countdown to the first day of school in person is like a ticking time bomb, unless we do this right. We've made clear that it's currently not safe, and it won't be safe anytime in the near future to open schools for in-person instruction. But it's important for not just our school leaders, but our entire community to know when it will be safe and what reopening will look like when that time comes. Despite the state removing the authority of local officials, county health departments to close schools for in-person instruction, we are responsible for a diverse and interconnected community of almost 5 million people. We have a responsibility to provide our community and school leaders with well-informed and clear guidance. That's the guidance we're sharing today on our roadmap to reopen schools. Before I share the details of the roadmap, let me give you some important information of where we are today. COVID continues to spread through our community at an unacceptable level. By any indicator, we are far worse today than we were when schools were first shuttered by the state back in April. A key point: we live in an interconnected community. Schools are more than just physical buildings. They're a part of the fabric of our community. Students, teachers, staff, parents travel throughout our county. They come into contact with a wide array of people throughout our community, and we can't pretend like schools operate in a vacuum or like children don't spread the virus to one another or to their teachers, administrators, school bus drivers, cafeteria workers. Throughout this crisis, our core team working on COVID-19 response and our public health department have worked with experts and with colleagues across the nation. In creating this plan, those same team members have revisited the contacts, have connected with local and public health leaders at all levels of government, both locally and nationally, on this topic specifically. The team has also researched local, state, national, and international models around reopening schools. This roadmap is designed to put Harris County schools back on track for a realistic, responsible, safe, and sustainable reopening. The roadmap has two parts. The first part is the Harris County threat level system, or color-coded system. I've said many times that we can't rely on arbitrary dates or wishful thinking when it comes to reopening. That's why the roadmap provides school districts with a common set of data, be they good, bad, or ugly, to guide decision making. The common set of data is our COVID-19 threat level system, which is currently at level 1, severe, red, uncontrolled transmission. The threat levels, red, orange, yellow, and green, are defined by 4 sets of indicators, focused as they have been since June on case and hospitalization trends, on the percentage of the COVID-positive hospital population, on the success of public health interventions, and on the widespread availability of a treatment or a vaccine. All the indicators must be met for the threat level to change. Some will argue that one of the 5 metrics looks better in an area or another. We can't grasp at straws looking for a data point or something that will justify an irresponsible reopening of schools right now. That's not the point of this or the point of the threat level system. What we can do is present clear research, best practices, and informed advice on when that day comes, how we should reopen. Tying the school reopenings to our threat level indicators takes out the politics and focuses on the data. It provides a common playbook that all school districts in Harris County and everyone in our community can use. That's part one. Part two is the Harris County Public Health review and approval of plans basically implementing the recommendations in practice. It focuses on the specific steps school districts should take at each of the 4 threat levels. No in-person instruction should take place at our current level, red. In fact, no gatherings of any kind should be taking place right now throughout the community. At levels orange, yellow, and green, schools are advised to reopen at certain capacity levels. Broadly speaking, 25% or 500 people, 50% or 1,000 people, and 100% respectively at each of those levels. But only if they can implement safe practices, particularly around cohorting and social distancing, which the research tells us is key. The roadmap goes over those practices in broad terms on issues from disinfection to cohorting to social distancing and mask wearing. It lays out a process for school districts to seek guidance and technical assistance from our public health department. Harris County Public Health will be available to review the plans and to approve those that truly operationalize the recommended practice. An approval doesn't mean that no cases will occur, but it means that it's a responsible approach based on best practices on the ground. Remember, in our current climate, where community spread is uncontrolled, where we are at level red, our official position remains the same. We simply cannot responsibly open schools to in-person instruction right now. I share the frustration of teachers, parents, students, school officials about the current situation. I understand the desperate desire to go back to school right now. I know that in-person learning is vital for the educational development, for the social well-being of children and young adults. I know it's a crucial lifeline for parents, for millions of working parents who are already struggling to get by and can't work from home. We are going to get through this. We will be back in school one day, but we'll be safe when we do it. What we can't do right now is bury our head in the sand. We can't ignore this. We can't tap our heels together and wish the current numbers away. When it comes to dealing with this crisis, we shouldn't be balancing politics with science. We should be balancing science with science. By committing to a common set of rules, we reduce the likelihood of this seesawing between open and close, which harms the students, which exhausts the community. Instead, we can work together. The curve will come down much faster. We will meet the metrics much sooner if folks stay home and follow our public health guidance. Right now at level red, no gatherings of any kind should be taking place. So think about that before you head out and decide to go to a restaurant or a beach or any kind of gathering. The extent to which you stay home and avoid all contacts will mean the day will come sooner when we can safely reopen schools. Let me conclude with this. To our school officials and superintendents, I know this feels like an impossible situation. It's hard. And I want to thank all of the superintendents and school officials who offered their feedback as we developed this plan. I want to send you a message today. We have your back. In fact, just yesterday, Commissioner's Court approved over $32 million to support a program for digital access for students. It'll provide over 250,000 devices, over 120,000 hotspots for children all throughout Harris County, throughout our cities and unincorporated areas. With the state's program, it means that school districts should not have to use their funds in order to support technology for our children. and that all of our children should have access to virtual learning tools. Ultimately, this guidance and this offer of support from our team, from our public health department, is an acknowledgement of the long and hard work that we still have ahead, and of Harris County's acknowledgement and commitment to stand by our children, by our teachers, by our community, with realistic guidance and not with wishful thinking. Thank you so much. I'm going to repeat my remarks in Spanish, then we'll hear from Dr. Shah, Representative Wally, and we'll take some questions. En español, repito brevemente, estamos reportando el día de hoy 558 casos en el condado Harris, fuera de la ciudad de Houston, 14 muertes. Ya en el condado han habido más de 87,000 casos, incluyendo la ciudad de Houston, más de 900 muertes. Durante las últimas 2 o 3 semanas he recibido llamadas de muchos superintendentes, líderes de escuelas, padres, miembros de la comunidad acerca de su preocupación, la reapertura en persona de las escuelas. Me dicen que no son doctores médicos, que son maestros, son educadores. Al mismo tiempo, la cuenta regresiva al primer día de clases en persona se acerca. Es como una bomba de tiempo y tenemos que hacer esto correctamente. Hemos hecho muy claro, lo hemos dicho ya varias veces, que en este momento no es seguro y no será seguro en el futuro cercano el reabrir las escuelas para la instrucción en persona. Pero es importante que la comunidad entera sepa cuándo sí será responsable, cuándo sí será seguro el reabrir las escuelas a ciertos niveles. Aunque el Estado ha removido la autoridad de nuestro Departamento de Salud Pública a requerir que las escuelas permanezcan cerradas, finalmente nuestro departamento, somos responsables por nuestra comunidad. Velamos sobre esta comunidad diversa, muy interconectada, somos casi 5 millones de personas. Tenemos una responsabilidad de ofrecerle a la comunidad y a los líderes escolares guía clara y basada en ciencia. Esas son las recomendaciones que estamos compartiendo el día de hoy en nuestra guía para la reapertura de escuelas. Antes de compartir los detalles de la guía, quiero dar unos puntos de información. El COVID se continúa a esparcir a través de nuestra comunidad de maneras no vistas y no aceptables. Sea cual sea el indicador que analicemos, en este momento estamos en una situación mucho peor de la cual estábamos en abril, cuando el Estado cerró las escuelas. Un punto muy importante, vivimos en una comunidad totalmente interconectada, totalmente atadas los unos con los otros. Las escuelas no son solamente edificios físicos, no son burbujas en sí. Los estudiantes, los maestros, todos los trabajadores interactúan los unos con los otros. Entonces, no podemos pretender que existe cada escuela de por sí separada del resto de la comunidad. No podemos pretender que los estudiantes no contagiarán a sus compañeros ni a sus maestros, trabajadores en las escuelas. A lo largo de esta crisis, nuestro equipo principal y nuestro equipo de salud pública ha venido trabajando con expertos y con colegas a lo largo de todo el país. Al crear esta guía, este plan, nuestros equipos han vuelto a comunicarse con estos contactos, específicamente contactos locales, contactos nacionales en el tema de las escuelas. Han investigado prácticas alrededor del Estado, de la nación e inclusive modelos internacionales. Esta guía tiene como propósito el poner nuestras escuelas del condado Harris en camino para una reapertura sostenible, inteligente y responsable. La guía tiene 2 partes. La primera parte es el sistema de amenazas de varios niveles que desarrollamos hace unas semanas. Ese sistema tiene 4 niveles. Hemos dicho ya varias veces que no podemos simplemente listar una fecha arbitraria y pretender que el virus va a obedecer una fecha arbitraria que solucionemos.
De lo que sí debemos hacer es tener una guía común, respetar los indicadores, sean buenos o malos, bonitos o feos, simplemente ver la realidad y adaptarnos. En este momento, los indicadores comunes son nuestro sistema de amenaza, de niveles de amenaza del COVID-19. En este momento, el nivel está a nivel 1, rojo, lo cual significa contagio no controlado y severo a lo largo de la comunidad. Los niveles rojos, naranja, amarillo y verde son definidos por 4 indicadores. Esos indicadores desde junio han tenido un énfasis en las hospitalizaciones y los casos, cómo van cambiando estos, el porcentaje de la población hospitalaria que tiene coronavirus, el éxito o no éxito de las intervenciones de salud pública y la disponibilidad de una vacuna o tratamiento. Todos esos 4 indicadores deben ser cumplidos antes de que se cambie el nivel de rojo a naranja, de naranja a amarillo, de amarillo a verde. No se trata de simplemente encontrar un solo indicador que nos dice que podemos abrir el día de hoy. Tenemos que ver todos juntos. Al atar las reaperturas escolares con estos indicadores, estamos ofreciendo a los distritos escolares una guía común que todos podemos utilizar. Se trata de eliminar la política de cómo vamos a atacar esta situación. Esa es la parte 1 de la guía. La parte 2 es la participación del Departamento de Salud Pública con los distritos escolares en implementar estos parámetros. Se enfoca en específicamente qué pasos deben tomar los distritos escolares para poder reabrir de una manera segura. En este nivel, el nivel rojo, el nivel 1, no debe haber ninguna instrucción en persona. De hecho, no debe haber ningún tipo de reunión a lo largo de la comunidad. A niveles naranja, amarillo y verde se le pide a las escuelas que consideren reabrir solo a cierta capacidad. Sí, 25% o 500 personas, 50%, 1000 personas y 100% respectivamente. Pero solamente siempre y cuando puedan implementar prácticas de seguridad, especialmente alrededor de agrupamiento, distanciamiento social, utilización de mascarillas y el poder desinfectar todas las varias superficies. Nuestra guía cubre las prácticas en general y también ofrece un proceso para que el Departamento de Salud Pública pueda terminar trabajar con todos los distritos escolares a implementar esta guía. Entonces el departamento se hace disponible para revisar sus planes y aprobará los planes que consideren apropiados. Recuerden, en este momento que tenemos este contagio tan severo, nuestra posición oficial es la misma. No deben haber escuelas en persona. Comparto la frustración, comparto el cansancio que tenemos todos, los padres, los niños, las familias, los maestros. Todos queremos regresar a la normalidad tan pronto posible. Sé que la educación en persona es vital, no solo para el desarrollo de los niños, sino también para tantos padres que trabajan. Y sí vamos a poder sobrevivir esto. Un día sí regresaremos a la escuela en persona, pero tenemos que hacerlo cuando sea seguro. En este momento no podemos simplemente taparnos los ojos e ignorar esto. No podemos solamente desear que estos números, que este nivel de transmisión desaparezca. En este momento lo que podemos hacer es comprometernos a estas guías y trabajar juntos para que esa curva caiga, para que los indicadores se vean mejor y para poder reabrir lo más pronto posible. Para concluir, le quiero dar las gracias a los trabajadores, los líderes de distritos escolares, los superintendentes que han trabajado conmigo en este proyecto. Sé que es una situación casi imposible, pero a ellos les quiero decir que estamos listos para apoyarlos. De hecho, el día de ayer, el condado Harris comprometió más de $32 millones para ofrecer no solo computadores, no solamente la asistencia técnica, sino también acceso a Internet a todos los niños en el condado Harris, a través de todas nuestras ciudades. Con este compromiso nos aseguraremos que los distritos escolares no tendrán que pagar de su propio bolsillo para poder asegurar este acceso a tecnología en este momento de instrucción virtual. Finalmente, esta guía, este plan y también la oferta de apoyo por parte de nuestro Departamento de Salud Pública es un reconocimiento del trabajo arduo y largo que tenemos enfrente. Y también del compromiso que tiene el Condado Harris para con nuestros niños, con nuestros maestros, con nuestra comunidad, y el compromiso a guía realista, no guía que se basa en lo que nos gustaría que sucediera. Entonces seguiremos trabajando juntos en esto. Toda la información está en readyharris.org. Thank you so much. We will now hear from Dr. Shaw. Thank you so much for all the work you and your team have been doing. And then we'll hear from Representative Wally and take questions.
Thank you, Judge, for your leadership and your commitment to this important issue. My name is Dr. Umair Shah. I'm the Executive Director, Local Health Authority for Harris County. And I want to first start by saying that our department has been working very closely with Judge Hidalgo, her team, and really we wanted to continue to do this work not just because it's public health, but it's also because we know how important this issue is for our community. Let me add to what Judge Hidalgo said by saying that the ongoing communication with our school districts, our educational partners, our local and regional health authorities, and of course our partners at the Houston Health Department has been key as we continue to make decisions related to schools and reopening safely. I'm going to provide my remarks from a public health perspective, also as a physician, but also as a parent of two children who are school-aged kids. For the last few months, our team has been working nonstop on this issue, and I want to thank my team, Dr. Iniego, Dr. Rivera, our school reopening task force members, who have all put a lot of passion and commitment into this issue. Many of them are also parents and very concerned about this issue themselves. We've also heard from parents and teachers and other community members of the concerns that they have for their children for in-person activities at school districts across our community. Our number one goal continues to be the health and well-being of our entire community, but we know that schools and children are such a critical part of this. This is a difficult time, as the judge mentioned, for all of us, educators, students, everyone involved. We know that all of us want to return to in-person learning and activities as quickly as possible. However, it is simply not safe to do so at this time. What we are releasing today, as the judge mentioned, are a set of indicators and a roadmap really for two things. One is, where are we today as a community, and the improvement in those indicators that are needed in order to help guide safe reopening for in-person instruction. I won't go through those measures because the judge has already done that, but let me say this about those, that this is based on information that we have reviewed from across the country, across the globe. These measures are a roadmap for what we believe it would be safe, it would take to have safe reopening for in-person activities at our schools across our community. This information continues to evolve, and we will continue to evolve with it. Our best advice for where we are as a community today means that as data changes, we may come back with evolving guidance. But today is not just about schools reopening safely. We want to also maintain that those schools remain open. It is a terrible place to be if we reopen schools and just a couple of days later they have to close. There are now examples across the country. In Georgia, a school district that reopened last week, I'm sure you've all heard, has now had to quarantine more than 1,000 students and staff members. We also know that kids are not immune to COVID-19 and can have serious impact and outcomes. A new report by the American Academy of Pediatrics and the Children's Hospital Association found that 338,000 kids have been diagnosed with COVID-19 in the United States. And we're now seeing something about the recent surges across the country as well as reopening efforts. More than 97,000 cases of children young adults from the age of 0 to 19 were diagnosed in the last 2 weeks of July. The majority of these infections were in states undergoing surges and having high levels of community transmission, which directly relates and translates to infections among kids. And unfortunately, that's what we're seeing here. We also know that if a child gets admitted to the hospital, 1 in 3 end up being admitted to the intensive care unit. So the reason I bring these facts up is that this is not, as the judge mentioned, that kids just get a simple infection and they move on. Kids are very important to the entire ecosystem, not just for their own health, but also the health of others, including teachers. And we know 1 in 4 teachers are over the age of 50 and have serious or other underlying health conditions. We also know that kids can also expose family members when they come home, parents and grandparents. We all recognize that in-person activities, in-person instruction is vital for the educational development and social well-being of children and young adults alike. In some cases, it's necessary for parents to be able to go to work. For many families depend on the educational system for food, childcare, social activities, and other types of assistance. We know that. We've heard that from our teachers. We've heard that from our schools. We've heard that from our parents. We've heard that from our community. However, this is simply not the time for in-person activities in our schools. We must do everything we can to protect those involved within the school system and our community at large. This is also not the time for us to fight amongst each other. Kids are precious, and we want to protect our kids. This is the time for all of us as a community, adults, community members, parents, to be role models, to come together, to take those actions, to do all those things so that they can model those behaviors for their kids, and also, as the judge mentioned, so that we can see our kids go back to school sooner than later in person. The role models include myself. My wife and I are talking about our kids all the time, and we're also trying to give them as much encouragement. This is a very difficult time for our community, especially our kids. We are very concerned about the mental health and well-being of our children. I will also say that it is achievable. So these metrics and these indicators, it may seem like, gosh, there's no way we're going to be able to get there, but we have seen a significant decrease in the numbers of people in our ICUs and our hospitals, and certainly the positivity rate of tests has actually come down, whereas we were up to 1 in 4 or 1 in 5, 20, 25%. We are now at 15 to 16%. These are achievable metrics. We can do this if we work together. Again, let me reiterate, there is no proof of a successful school reopening across the country or globe when transmission levels are as high as we are seeing in our community. But our role from a health perspective is to take all the information from across the globe and the system to speak with and engage with our community members, especially our school officials, and to make informed decisions about this guidance, about where we are today and when it is safe for schools to come back in person down the road. That time, unfortunately, is not now. I want to thank you, and I know we can work together to fight this pandemic and have a sooner time frame for us to have our children back in school in person. Thank you, Judge.
Armando Wally, State Representative, District 140. I just want to thank Judge Hidalgo and her team for always following the science and not the politics, and taking the politics out of the protection of our children, because that's first and foremost what we need. That's the type of leadership that we need, particularly from our Harris County officials. And Dr. Shaw, thank you and your team for all the work that you guys are doing to protect children, and all the team, the epidemiology team. I know that you guys have been working nonstop on this issue, and amongst all the other issues that we're working on. Listen, guys, these measures are important measures to protect children. At the end of the day, we all want our children to get back to face-to-face instruction. We all want our children to be interacting with their other little friends. We all want our children to go to recess. We all want our children to sit down and have lunch with their friends. That's part of the educational process as well. But we understand that the better and the fastest way to do that is for all of us to band together to bring down that curve. Because the faster we can do that and band together, the faster these children can get back into school. Again, I'm a father of a 9-year-old and a 6-year-old who are about to do virtual schooling in about a week. It is very difficult as a parent, and I want to speak to the parents. I can tell you, not just with empathy, but with personal experience, the difficulty it is, the patience you have to be able to homeschool your children while you're trying to put food on the table. I understand that. Me, my wife and I, we understand that. And so what I want parents to know is that the judge, Dr. Shaw, are taking your considerations into account, right? Because at the end of the day, it's the safety of our children that is first and foremost. So parents, still be patient with your children. Be kind to your children. There are going to be some tough times. Believe me, I've experienced those at the end of last semester with my 2 children, how tough it can be, how to try to get your 2 little boys to sit down and do homework, and in essence, try to get them to pay attention and look at a screen for a couple of hours to do their assignments. I understand that. And on top of that, the various school programs that they have to log on to be able to finish and complete their homework and their assignments. We understand that. At the end of the day, it's about the safety of the children. And so I do want to also acknowledge Commissioner's Court for their action yesterday on the $32 million on digital divide. On particularly, it's a concept of digital divide that has long-term implications, but in the short term, this is a great investment, $32 million investment in children and families so that they can get, one, connected in hotspots, but also the devices for those children that may or may not have a device. And there's going to be partnerships, I understand, with the independent school district, so that's going to be a very, very robust program, and I want to thank Commissioner's Court and Commissioner Garcia, I think, is the one that sponsored the item. So that is a big step in the right direction. Lastly, at the end of the day, these recommendations are following the science. They're not following the politics. And to the extent that we can work together as a community, from the superintendents to the teacher's aide, the paraprofessionals, the registrars, the custodians, the bus drivers, the mechanics that work on those buses. It's all about all of those folks, and obviously the teachers and the children that are in these classrooms. And we hope to get them there sooner rather than later. But look, at the end of the day, we need federal help. At the end of the day, we need federal help because there's a lot of families that need child care, Dr. Shaw and Judge. They need child care to be able to get to work as well. And so I'm asking our state and federal partners to pass a bill to get us more resources to do the work that we need to do the public health that we need to do, but also to respond for the recovery that is about to happen in the next couple of months. So thank you, Dr. Shaw. Thank you, Judge Hidalgo. Appreciate your work.
Thank you so much, Representative. We'll now take questions.
Yes, Judge, the number of media outlets are wanting to know, first, these are recommendations. They're not, is there any path for them to be enforceable to the school districts in Harris County?
Yes, so remember that we had the authority initially, right, to require that schools not open for in-person instruction. Unfortunately, that's been stripped away. But we're unwilling to sort of hide behind that and not offer guidance, not offer advice in the absence of it. So this is us standing up and saying, these are our recommendations. We strongly urge each of the recommendations on here. They are based on best practices. They are comprehensive. They fill a void. And what happens in the absence of these recommendations is folks sort of pick and choose, you know, a way to justify
an irresponsible and early reopening. So this is us standing up, offering a resource, even if it is a recommendation. We think it's important as county government for such a massive, diverse, and interconnected community to have this available. But yes, they are recommendations.
Now, the superintendents of the school districts in this county, how much communication have you had directly with them in formulating this plan? And how have you been getting some feedback from them regarding needing more clarification on what you're proposing prior to this document here?
A lot of communication with the superintendents. They all have my phone number. I was in touch with them directly over the past few weeks. Dr. Shaw has been in touch with them. We focused on a smaller group of superintendents of 4 who were from diverse areas of the county, worked with them even more closely. Different kinds of feedback. This document incorporated a lot of it. I think the biggest challenge is the folks that just want to reopen now. And so that's not what this document is. The sense was not to go and try to find, okay, what data point can we pick that's going to help lend credence to an early reopening. It's instead being intellectually honest, looking at best practices. How should this be done? When should it be done? That's the result of this. But superintendents right now under a lot of pressure, a lot of people pulling them in different directions. And so our hope is that this will be a resource for them, for the school boards, for the community members, for the teachers. But I'm not going to pretend like this document has unanimous support. It is a discussion, and then it was fundamentally, we have to provide what the best practices show. As Dr. Shaw said, there is no example of a successful reopening in a community with numbers such as ours, either now or anytime soon. And in fact, we have to look at all indicators, and we have to look at the entire community. We can't pick and choose a certain zip code and whatnot.
Now, the TEA apparently the TEA says it's still debating if it'll track COVID cases in public schools. What would you say about the guidance you're getting or not getting from the TEA, and is there a message you have for the TEA?
Right now, we're stepping up. That's what government's supposed to do. Government's supposed to provide guidance. Government's supposed to be there to respond. And so, irrespective of what the TEA does or doesn't do, our department will be there, when and if cases are found, to support the schools, particularly those for whom we're the only health authority, support with contact tracing. But being able to follow these recommendations puts the school in a position to reopen for the long haul, not be seesawing back and forth, and to, once some reopening happens, and inevitably there is a case, to allow us to close perhaps a certain cohort and not the whole school. It's going to take work. It's going to take getting those numbers down and then implementing these measures in practice. And they're quite thorough, but of course it would have to be done in conjunction with the department.
Now, is the county going to be trying to track presuming that there are schools that do open, is the county going to be tracking COVID cases that come from the schools? Is there a plan for that or a process?
We do ask here that schools, irrespective of what they choose to do, that they reach out to us and reach out to their health department if there's concurrent jurisdiction when and if cases arise. And so, of course, we're going to be trying to keep track of that. We're going to be trying, of course, we rely on the schools reaching out. But what we're saying is, why wait until there is an outbreak? Why not plan? Why not be proactive? Why defy the science and the best practices for the sake of political expedience and putting our children and our teachers at risk? But yes, we will be there, and to the extent that we get the information from the districts, we'll keep track of what's found.
As far as the initiative to provide technology to the underserved students and areas, is this something that you're doing in direct conjunction with the school districts, or is this more of a county, like an educational initiative, without direct coordination with school districts?
The initiative to provide technology is in very close coordination with the school districts. We've been sending surveys, we've gone back and forth with the districts to understand their specific needs, and we'll continue to stay in touch to see if somehow we missed a particular population of students. And so the idea is the state put forward some funds. They require a match. Rather than have the school districts match the funds, the county will do that. And then in addition to the state program, the county has gone outside of that and into its own separate program to cover any gaps that the state program may have missed. We're doing this as quickly as possible. As soon as those devices arrive, should be in the next 2 to 3 weeks, which is not fast enough for some of the schools that are starting very, very soon. But this is a Herculean effort, and it was done in the way it wasn't so much, okay, how many funds do we have available and how many devices will that buy? Quite the contrary. We asked the school districts, what do you need? We calculated what of that gap will the state meet, and then with what was missing, we figured out how much that costs, and those are the dollars we're putting forth, which is $32.1 million.
So is this, is the monetary part of this, is it basically sending that to the school districts for them to purchase the computers, and or is the county purchasing the technology? I mean, how is the money going out, and how does it actually, who actually makes the expenditure?
It's in partnership. So the first chunk through the state program, that is once the schools have the agreement with the state, then we will send those funds, and the state is procuring those materials. The second part of the program, which is to fill any gaps that may exist, that is more directly coming from Harris County. Overall, right now, they're in the process of, they've already started the process of procuring the hotspots, the computers, and getting them over here as quickly as possible. But it's an ongoing process. It's not something that it starts and ends today. The part of the charge at Commissioner's Court yesterday was to make sure that we constantly get our reports. How is this going? Are certain communities behind? And what are we hearing from the school districts that they still need and they don't have? One of the issues we identified too in some areas of the county, the areas that are more rural, we may be able to give them a hotspot, but there may not be a cellular tower to where that will truly make a difference. And so that's why part of our plan where we say, okay, at Orange you could have 25% of the population or 500 kids, whichever is smaller. There are certain priority populations that we recommend school districts consider, and this was done in consultation with the superintendents and with the experts. And so some of it is students with special needs, English as a second language, and also students who don't have, whose connectivity issues we can't solve right now. And I know Representative Wally and I were talking about this, there's a challenge that probably the legislature will have to address at some point, but that's one of the priority populations, for example, that we recommend and we urge schools to focus on as we get to Orange. Right now at Red, we're strongly against any kind of reopening. We'll be there when the schools have cases and they need to figure out how to do contact tracing, but we ask that schools not reopen in person right now.
There is a question about the $25 million in direct assistance payments, and is there a process for families that to apply for this in place? That was apparently from yesterday.
We committed $25 million in direct financial assistance. That is on top of the $30 million that Harris County already allocated and has been disbursing. And that's because we recognize the economic pain that families are under right now. So that program is currently being worked on. We're working so that folks who applied for the first program are automatically considered for this one. We know a lot of people applied and were turned down. We received a lot of applications, but it'll be similar. It'll be a randomized drawing. It will not be first come, first serve. And folks who with lower income, folks who've not received aid first, folks who are more vulnerable will have more entries in the randomized drawing. The process to apply for that has not been made available yet. We'll make it available as soon as possible, but of course we've got to build the program, and that takes a couple of weeks.
Okay, I think that covers the questions.
All right. Thank you.